Well, these figures suggest that the global number of cases far exceeds the number that the WHO actually knows about, which currently stands at some 35 million. The true figure, we understand, could be more than 20 times that, but still the vast majority of people at risk, some 90% of the population still vulnerable to infection, with the disease very much continuing to spread, and particularly as we now enter a difficult period, the global pandemic coupled with flu season. We're seeing surges in infection, particularly in Europe, Southeast Asia, as well as the Eastern Mediterranean. Here's what the WHO's Mike Ryan told a meeting of the Executive Board on Monday.
Our current best estimates tell us that about 10% of the global population may have been infected by this virus. This varies depending on country, it varies from urban to rural, it varies between different groups. But what it does mean is that the vast majority of the world remains at risk.
Now, the two-day meeting is about assessing the WHO's progress at handling the health emergency as well as its preparedness for future crises. What we've learned from the last couple of days is that the body says its work is hindered by problems of funding, particularly its dependence on donations, which leave its finances vulnerable in dealing with a situation of this scale, as well as a feeling that WHO staff are overstretched due to the pressures of coping with the unprecedented nature of the global pandemic. We've also learnt that the WHO has submitted a list of experts to take part in an international mission to China to investigate the origins of the coronavirus amid allegations from many in the international community that China hasn't been fully transparent about the early stages of the outbreak. Hough, SABC News, Brussels.